All right, Health Rev fam, what is good? Today is Monday. Boys are grinding late tonight after an early start in the clinic for both of us. No Subas today. It's all right. He is doing other things, but that's all right. With the boy, the two of the boys are here. So today, our topic of discussion is about core stability. The what we did is we kind of read an article on our own, and are going to just chat about it, kind of our thoughts, and try to apply it to our viewers. Um, the article was The Myth of Core Stability by Professor Eyal Lederman. I apologize, Eyal, if I just butchered your name. I think I got the last name. It's an article that I have wanted to read for quite some time. It had been referenced by several of kind of the PTs I follow on Instagram and YouTube, like the physio tutors, Adam Meekins, all these people had mentioned this article, and for the longest time I've wanted to read it, so I'm glad I was able to kind of sit down and read it. For me, I can't say I learned a ton or it changed a lot of things. It definitely like confirmed a lot of the biases that I have. Um, I guess a quick little overview of it was basically, I talked about like how core stability started and like basically talked about probably core stability is a little bit overhyped because, you know, here, let me just look through. Okay, so one of the claims they talked about was like the timing of when you activate a certain muscle in your core. These core stability crowd people would kind of hype it up, say it's important, you know. And this author said, yeah, there's really no evidence supporting that claim. Also, sorry.
Why, like, maybe why is timing important? What do you mean by timing of core muscles? Why do I might need to time my muscles?
Well, I'm not going to make an argument for why you should, but
I don't need to make a nut for, but just saying, like, why would
yeah,
people say that?
yeah. I mean, I think what we do have evidence to support is like when somebody's in pain, the way your muscles fire is going to be different. So I think that claim of like you have to activate your core at the right time was based on these studies about people already in pain in the TVA, which is just an abdominal muscle. The TVA was activating, a little bit behind that one, and then they're like, oh, so we need to train that and fix that. When really, that's just like a non-volitional thing that your body was doing, basically a normal response to pain. Um, and then the other thing you guys hear all the time probably is like, oh, my back hurts because I have a weak core. This article basically kind of bashed that and said there's really no evidence to support that a weak core is correlated to pain or that core strengthening is the cure all to all your back pain. Um, Another thing I like to talk about, or I liked that it said, was that a lot of these people who promote core stability, they get you like thinking about activating your core. Rainey, have you ever been to PT for back pain before?
Nope, I'm not.
Okay. Well, I did. And back in probably like 2017, I think I was a freshman at Springfield College. And I was struggling with back pain. I was in the weight room, kind of messed up my back a little bit. So I went to PT. The one, it was probably like 5 minutes away from campus, right in the heart of beautiful Springfield. Great city. um,
Springfield?
and this guy, he was a big, he was really into that, right? He would basically the cues he was giving me with all these core exercises was like suck my belly button in and almost feel like do like a Kegel. Now, for a Kegel, for those who don't know, is something that like pelvic floor PTs do, and it's basically this feeling of like stopping peeing or stopping the urine flow. So like he had me doing all that, and guess what? I got better. Now, looking back, do I think it was the core stability exercises? Probably not. My point in this bringing it up is he had me thinking a lot about activating my core, right? Like, and I remember then this got me questioning, like, wait, how do I brace when I lift? Do I want to bring my belly button in when I lift? And this led me down to like a little mini crisis, questioning everything. But this article said, yeah, you know what? It's not worth thinking about, again, the timing or the activation. Because again, our bodies are really good at kind of automatically activating what you need to. Again, if somebody hands you a weight in one hand, guess what? The abdominals of your other side are going to kind of non-voluntarily contract, and that's a good thing, right? We don't want to have to think about that. And they said if you do, you're going to kind of like mess up with that timing. Oh, and then they talked about like movement economy, and they said, do you think like Michael Jordan is thinking about you know being the goat when he's doing when he's playing basketball? No. So I thought that was a pretty cool correlation. Um, and then the other thing is, again, this is what I was quite familiar with this, but basically core stability exercise is fine. It can work for back pain, but it's no better than just general exercise. So you might as well do something you enjoy is kind of another big takeaway that I had. Yeah, Randy. So those are mine,
Mm.
basically from the article, but did you have any thoughts, takeaways, questions? That's enough of me rambling.
Very good. Um, yeah, I thought the big one was at the end where they said like there was no big difference between patients who did core stability exercises or general exercise in treating chronic low back pain. And I think that's not just like, I mean, we could dig into more literature, but I'm pretty sure that's like really common in just the guidelines for treating back pain in general is like, I think that I need to look at like what the quality of evidence would be for core stability exercise, but like I think compared to general exercise, like I don't think there's a yeah, one or the other is like just getting the patient moving.
Yeah,
And
and then something
it's
do you
also
think we
like
should do?
what health beliefs are we encouraging or promoting?
Yeah, and I don't know if we said this, but we should probably say like core stability exercise is basically these low level, low intensity. Many would say boring. I would say boring exercises where you're probably on a table. Again, maybe you're doing like a bird dog, a dead bug. I actually kind of like dead bugs, but probably a bird dog, right? One of those things. Or you could be doing like basically just one exercise is like you're on your back and you're just sucking your belly button in. Again, thinking about sucking your belly button in and doing that Kegel while maybe you're doing something. Maybe you're doing like an arm overhead, arm out to the side. Maybe you're doing like a bird dog type thing. So for sorry, I just wanted to, for the crowd who doesn't quite know what the heck we're talking about, I probably should have done this at the beginning, but I'm doing it now. So sorry.
I feel like there's a couple ways to define core stability exercises, and I don't feel like the article did that specifically. Because like, is all core stability exercises bad? Like, I think like, is you consider like a deadlift a core stability exercise? And is it wrong to consider it that? Um, that's one question I have. And then I think just like the way maybe the article was looking at core stability was more of just like in that like, yeah, like you said, low load, light intensity. I think it's putting a patient in that like it's a safe position where they're keeping their back kind of flat against the table. We're not moving the spine, and we're just loading and moving the rest of the body. So kind of just placing like an isometric load on the spine, which is probably safe to start. But yeah, I don't know. What are your thoughts?
I mean, I think me and you might consider a deadlift a core stability exercise, but I think the core stability crowd, the people who are identifying in that crowd, are not going to call it deadlift a core stability exercise. And I bet most of them probably don't do deadlifts nor think deadlifts are good for you. That's my thoughts on that. But I think for this case, when we mention core stability, we're talking about more of that low level table based stuff. Um, did you want to go, or I have a question for you if you don't?
No, go for it.
Um, Either personally or as a PT, are you a core stability guy? Do you hand these out to your patients frequently?
I don't tend to use a like a dictionary of exercises where I'm like, you got back pain, we're gonna give you the Stu McGill's like big three. Like I don't tend to do that, but like I'll sometimes if I'm working with a patient early on that they might get those. I do have to try to be careful of what narratives I use because like I think things get used very lightly and terms can be thrown around real quick. And I'm then guilty of using um, some language that I usually try to promote resiliency and kind of some movement exploration and um, kind of what can get the patient feeling better. But I've definitely like if a patient comes in talking to me about like their beliefs in core stability exercises, I'm not gonna. I'll usually start out and talk to them about transverse abdominis and like all this other stuff versus like kind of tearing that apart in the first like couple visits. I don't know. It's kind of tough. But that's kind of where I'm at.
Yeah. So you probably don't give out a ton, is what I don't know if you answered that part.
Yeah. Okay. Yeah. I do. I like planks. And they're a nice energy system and get the patient working hard. Um,
Yeah.
and bird dogs, dead bugs, they're a staple. They get used a lot in the outpatient clinic. So yes, I do give them out, but
Okay. So you got bird dogs.
not like
Um,
not alone. Like they're
yeah.
not like my only.
Yeah. I think for us, in what you guys will pick up is we don't necessarily care what you do. We care what your reasoning is behind it, and then more importantly, like the narrative and what you're telling your patients, right? And this applies to manual therapy, dry needling, but also exercise, right? Like if you tell a patient, hey, we're gonna do a bird dog because it's movement and you're just gonna get you moving, right? You're pretty sensitive right now, so we're just gonna get you moving. This is a good entry point. Sweet. Now, if you go into the whole, well, based on your evaluation, we found that your core was unstable through some probably questionable special test, and then sell them that their core is weak. We don't like that because then that's promoting this mindset of fragility, and then that's going to have that person thinking, "Oh my gosh, my core is weak. Oh, OMG!" Right? Whereas, so it's again, we're about pretty much anything can work, but you got to just watch your narrative around it. Um, and then for me, I probably don't give out a lot of those, but if I were to think of a time and a place where I would, it would be basically just what I said. Let's say you have a lifter, right? Maybe they freshly injure their back doing a lift, right? In the rare case, I don't feel like we don't see a whole lot of like fresh symptoms. It's more of chronic things that we see, but let's say we do. And they're very intolerant to any sort of flexion extension movements. That's where I'll probably give out something because, yeah, if we can do movement that's pain free or very minimal pain and tolerable, beautiful, right? We're getting the patient moving, we're improving their confidence, all that good stuff. Again, I'm not going to tell them be sketchy with my reasoning for giving that. Um, it's just going to be simple. And then, but the end, right? The thing where a lot of lifters are left short is the PT doesn't really know too much about lifting, and that's all they do. You do bird dogs thinking you're going to be prepared to lift 500 pounds. No, 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 no. That needs to be progressed at once the patient is more tolerant to movement and loading. So it's like an entry point, in, if anything, for me in an acute injury or acute pain.
That's interesting. I like that you brought up the weightlifting. I know we've been talking about it and stuff, but question I have that I was thinking about when reading this article was how there's the rehabilitation aspect of core stability exercise, but then also the performance aspect of things. So you get a lot of athletes that are going to come in, and sometimes not even for PT, but like I feel like a traditional, like old, I don't know, classic way of coaching could be incorporating core exercises. As a runner, like I think there's a big piece of like the running culture and health beliefs is like to be a good runner and be an efficient runner, you need to have a strong core. And that's so like I'd say in high school I was doing planks, dead bugs, and bird dogs very frequently, which I is kind of funny because I kind of don't think about that a lot, but we still do that quite a bit. Um, and a good point came up in the article was how like during walking, standing, and I'm gonna kind of assume running that your core. It said something about how our core muscles have very little activation and or don't do a whole lot, which I thought was kind of funny.
Yeah. Yeah, right. They did mention that. Yeah. But then you got patients who have been told, you know, you got to activate your core when standing or sitting, which is like,
Mhm.
you're not being Michael Jordan. You're thinking too much at that point.
Mm. So we were talking about maybe some point working together and maybe coaching or I don't know, throwing the idea of you do the strength work, I'll do the run coaching. From your perspective of what you would be doing, liking to do some strength programming, what are your thoughts on core stability for runners?
Yeah, I mean, as somebody who subscribes to the said principle, specific adaptations on imposed demands, I'm not sure how much carryover holding a plank for 5 minutes is going to have into running really well, really fast. Um, I think if you're dealing with a runner with back pain, again, maybe that's an entry point. So I'd use the same example, right? Like the runner is very sensitive. It's a hot, acute situation. Sure, do some core stave stuff. Is that going to be a staple in my training long term? I like suitcase carries,
Mm.
right? And that could be considered a core stability. But again, on the spectrum of core stability, if you have core stability spectrum, you have like table based sucking your belly button in. And then further along, I would say a suitcase carry. You can have more carryover because you're actually, on the earth like you do when you run.
Mm.
You're holding something, right? You're also going to load other muscles too. So it's not just core, right? Like the abductors, which is an important muscle in runners, right? So if I were to write a program out, it would look more like that.
Would you consider using planks and dead bugs and bird dogs in your program? And if so, I don't want to lead you in a direction specifically, but would you use those exercises in the program?
Is this person in an acute high pain state?
No, but like if you're like training and
No, I wouldn't then.
there's no what you're saying, and I don't want to put words in your mouth, but there's no like is there not practicality, but like utility to doing planks, dead bugs, or bird dogs? Because I'll just say, it. Could it be used as a stress tolerance or like as for like a runner if instead of running? I mean, if somebody doesn't do like strength exercises all the time, could it be beneficial as like not a core stability exercise, but more from another perspective of like stress? Um, yeah, on a stress tolerance.
I think unless the person is sensitive, if they're sensitive and they can't run, sure. But if they're running and they're just looking for like strength training exercise to help them perform, no.
Okay.
Now, if they're a rehab client or and they have on and off episodes of pain, maybe this is like your backup plan. Hey, you have a flare up, you can do these for lower level exercises. And I'm not saying my way is the right way, right? Sure. If you want to do that, sure. I could probably make an argument if your goal is performance, like let's think about time efficiency here. Is that going to have the best bang for your buck when you can be doing squats and deadlifts, which also load the spine, suitcase carries, like I said? But I'm not going to say you're a bad coach if you program that or
My
anything like that.
my strength coach is programming me planks, man. I think I gotta talk to him. I'm just kidding.
I ain't calling out your strength coach, but
Mm.
I mean, there's definitely a mentality, right? Like if you can hold a plank for 6 minutes, you're a savage. You're more of a savage than me. I can only go like, we did a challenge for work and I got like 3 minutes and I tapped out. I was being pretty soft. So okay, maybe that's your argument. You could make a right like the cold plunge thing, right? Cold plunge gets a big rap. I don't think I subscribe to like the physiological benefits that people claim, but like undoubtedly there's something about psychologically doing hard things. And if you're out there holding a plank for 5 minutes, you're more of a savage than me. So you could probably run longer than me too, right? Put through pain.
That athletic mindset's a big part of it, and, like, for a runner, like, I think doing planks is and foam rolling is just part of that athletic running identity, which is tough to change. I think I could go without doing either, but, like, do I enjoy and or do them still? Yes.
Right.
Yeah. I got one last question. Um, the article opened by talking about let me read the sentence. These findings, combined with general beliefs about the importance of abdominal muscles for a strong back and influences from Pilates, have promoted several assumptions from prevalence in core stability training. Okay, so talking with general beliefs, it just says influences from Pilates and doesn't go into any more details. I would love to pick that apart, and maybe we could talk about that more in the future. But do you have anything to add on that? Because I know I get patients
Can you
coming.
say the quote one more time?
Yeah, it was. I don't know. The sentence is more was just like an intro to the article, but it was saying how that core stability gets some of its beliefs and or some of like those assumptions are from Pilates. I would like to dig into that a little bit more. We don't need to necessarily do it today, but I think a discussion down the road could be cool because you get patients coming in who enjoy Pilates, and I mean, I'm say I'd like to know how to communicate and understand the whole idea of Pilates. But why? How does it? Yeah. What do you know anything about that?
No, I don't. But maybe that's your niche, dude. Maybe you can niche down and become the Pilates. You can dig into that. Let us know, and then you can become at the Pilates PT on Instagram.
I'm good. Thanks.
I
I,
can't say I had that same thought reading that, but yeah, I mean, clearly, I don't know too much about Pilates.
I could go back into history because I think that would be cool.
Yeah, why don't you do a 5 hour deep dive onto Pilates and then,
I'm gonna find a YouTube video and read it for like a minute.
yo,
That's
I did this research and I found it.
right. All right, that's everything I was thinking.
So one thing I would like to say is right, we have a patient coming in, they're concerned about their unstable core, their weak core. So what we would do, or what I would do, obviously not on the first visit, right? We're not out here challenging people's beliefs on their first visit, but at some point, you'd want to help them challenge that. So you could say, hey, we actually don't really have much evidence supporting that claim. That's more like something that somehow got really picked up popular in the fitness realm. That would be the first thing to say. And then, you know, I think through action and by doing, people pick up a lot of things. So what you could do is like start having them do more. Again, I'm a pretty big like loaded mobility, you could call it, right? Spinal loading through movement, right? So like your Jefferson curl where you're bending your back, right? Kind of the anti-core stability, right? Core stability is all about, oh, don't bend your spine, keep it rigid, right? Jefferson curls, side bends, right? Where you're doing all that stuff. Any sort of extension based exercises, right? And you think if somebody does that, right, you can show them, hey, you just did all these movements with your spine with load. And then hopefully you can start to see them become a little bit more confident, right? So in my opinion, I see like, again, nothing wrong with core stability, but you'll often find that people who are big into core stability are like having a fragility mindset, right? Do they think people doing core stability exercises? Do you think do you think your back is strong? I bet a lot of them would say no. Whereas you see somebody in the gym crushing Jefferson curls, side bends, all this cool stuff, they probably have some high confidence in their spine. They think it's strong. And we know that that is a massive predictor, right? Your beliefs are a massive influence on what you experience and everything in life, right? Including pain. So we're obviously big narratives, beliefs people here as well. So
I like that.
do your Jefferson curls, do your loaded spine over core stability, in my opinion, unless you are in a very high acute pain situation. Then you can crush some bird dogs. But other than that, we like I like loaded mobility.
So essentially, just don't stop your loading, load the back, don't stop at core stability exercises because we can do more.
They have a time and a place, but I think they're overhyped, like a lot of things in the fitness industry.
Cool.
And they got me. I got the bug. There was a time where I was doing the McGill Big Three before every lifting session, right? You know, I feel silly looking back, right? I was like, oh yeah, I'm definitely preparing my body to lift 400 pounds. No, you're not. Sorry about the ring. I'll go on mute real quick.
You want to call
All
it
right,
right?
Rainey. Did you have any other thoughts?
Nope. You can close it up, Matt. That's it for me.
All right. You guys heard it. You can let us know in the comments if you have any disagreements, agreements, or thoughts. You'll probably see some clips on Instagram as well. But yeah, guys, thanks for listening in. Hope you have a great week here. February is around the corner, and we'll see you on the next one.
Yeah. Peace.